Hello, my name is Brett Bell, student physical therapist at Ohio University, and today I will be demonstrating how to go from a sideline position to a prone position on a wedge and back to a sideline position. Goals for this maneuver are to provide a position that facilitates trunk extension, forearm weight-bearing activities, and head righting in the patient. Another goal is also to place the patient in a position that allows for passive trunk extension of the abdominal region. Frequency of the position change is dependent on the patient's abilities and their comfort. They should be moved from the prone position on the wedge whenever they find discomfort, whenever the rehabilitation has ended, or if they can no longer continue the rehabilitation in this position. Before we begin the maneuver, we need to go through the patient's instructions. To begin those, we need to determine the assist level of this patient. This patient's assist level is contact guarded, which means that I must have hands placed on her to make sure that I can assist if it is ever needed. We also need to determine if the patient has any pain or discomfort before we begin the maneuver. Kennedy, do you have any pain?
No.
Is there anything I can do to provide more comfort?
No.
Finally, we need to determine if there's any tubes, specifically in the abdominal region, that may be yanked on or become dislodged during the maneuver. She currently has none, but if there were, we may need an abdominal binder to make sure that they are attached the entire time. We also need to prep for the skill. To prep for the skill, we need to introduce ourselves to the patient. Kennedy, my name is Brett Bell. I'll be your student physical therapist. And then we also need to tell them what we will be doing. Kennedy, what I will be doing is I'll be placing you flat, face down onto this. Is this okay? Finally, we need to make sure there's plenty of space around to allow the maneuver to occur with the patient's safety in mind. As you can see, we have plenty of space here on this mat. To go from the sideline to prone on a wedge maneuver, we need to ensure that the patient has their arm in the position of horizontal adduction, and then we need to make sure that the wedge is at their chest level. We also need to instruct the patient, go ahead and put your arm right there, and then we need to make sure that their legs are straight and extended so that the maneuver can occur without any discomfort. Next, we will instruct the patient into the proper position to get onto the wedge. Kennedy, can you go ahead and pull this arm backwards towards me and sit on your elbow? Making sure to keep our hands on the hip and the thoracic region throughout the maneuver. All right, Kennedy, now what I need you to do is go ahead and reach across to the other side. And now we will assist the patient onto the wedge. Go ahead and pull yourself on. Finally, to place them in the correct position, we assist them in any way possible to get them flat on their forearms flat on the wedge in front of them, and then make sure they're in the correct position of hip extension and a slight knee flexion on the wedge. To bring them off the wedge from a prone position on the wedge to sideline, we assist the patient from the middle of the wedge to the side they're going to roll onto, and then we instruct the patient. Kennedy, can you go ahead and put your arm right here? We internally rotate their arm so that when they rotate off, their arm is in the proper position. Now, with our hands on the thoracic region and the hip, we assist the patient. Go ahead and roll off as slowly as you can, making sure to maintain safety, and then go ahead and slide your arm. Yep. And then we bring the patient's knees back into an extended position, ensuring the patient is comfortable. At the end, we ask if there's any pain.
No.
And is there anything we can do to provide more comfort?
No.
Next, this patient's assist level is moderate assist, which means we provide about 50% of the assist during the maneuver. As before, the patient is in the sideline position, so their arm is already horizontally adducted, and they have an arm laying on the wedge, and their legs are extended below the lower extremity. So now what we would do is we will assist the patient into the side position on their elbow with our arms in the thoracic region and our other arm on their hip. Now we will move their arm to this side and have them assist as much as they can and lift them onto the wedge. We will also assist them by holding on their shoulders and pulling them forward onto their forearms, and then straightening out their body with the lower extremities. And then to come down off the wedge into the sideline position, we go back to the same position of the hip and the thoracic region, slide them over to the side of the wedge they're going to be rolling off of. We place their right arm into internal rotation, so when they slide off, they're already in the right position, and then we slowly assist them down off of the wedge and make sure their arm slides out into the front of the wedge. We position them, and then we ask for pain or discomfort. Are you comfortable?
Yep.
Is there anything we can do?